So welcome everybody. I'd like to present you today a little bit more on what has happened last years on Pura syndrome from a clinical perspective. Because it all started in 2013, I think many of you know the papers published in 2014 with the first Pura mutations, but actually it already started in 2013. I'll come back to this later. And if you look at the number of patients published in all these papers, we see that in the first years, the majority of papers only included a few patients, and that more recently published papers, so in 2017 and also this year, larger cohorts have been published. And I realize that this is, for me, a large number of patients, for example, 32, but that for you as parents is that quite a small number of patients. And if you look at these papers here marked in green, these are more recently published papers. We see a little bit of a shifting from papers reporting on the general aspects of the Pura syndrome towards more articles focusing on specific aspects of the Pura syndrome. So back to 2013 on the timeline. The 5q microdeletion syndrome is a well-established syndrome already known for years, caused by deletions on the 5q chromosome. And in 2013, a patient was identified with a very small deletion, only including a few genes, including Pura. And the authors of this article concluded that haploinsufficiency, what means only the presence of a single copy, could be responsible for the neurodevelopmental features present in the patients with the microdeletion. This suggestion was confirmed 1 year later in 2013, when the first 2 papers were published reporting on patients with point mutations in the Pura gene. The first article reported on 11 patients, mainly USA-based, and the second paper by David Hunt and other co-authors reported on 4 patients with mutations in the Pura gene. These papers only contained a relatively small number of patients, but if we look at a subset of these patients, we can conclude some things based on the facial appearance of these patients, because almost all of them have this classical open mouth appearance caused by a severe hypotonia of the muscles in the face. And it also reflects the hypotonia in the rest of the body, but we see it here as the classical open mouth appearance. We also see here, on the right side, a patient which is also very illustrating the Pura syndrome. It needs oxygen. We see that in a lot of Pura patients, and it's also reported in these first articles that many of the children from early childhood have problems with respiratory issues. Because of the small number of patients which were initially published, it was difficult to say anything about very rare features to this syndrome. But the authors could tell us something about the core phenotype of this new syndrome, consisting of the severe neurodevelopmental delay, epilepsy in a significant part of the patients, also abnormal movements, hypotonia or the weak muscles, brain abnormalities, and then mainly the delayed myelination, neonatal respiratory insufficiency, as I already told you, but also feeding difficulties, which were present in almost all children already from birth. Quite soon after publication of the first 2 articles, this paper appeared online describing Pura mutations in about 6 patients. Also, these patients were based in the USA, and because of also this paper reported only a small number of patients, they couldn't make any extra conclusions, but an important conclusion they wrote in the paper was that the phenotype was consistent with the patients described in the first 2 articles. So there was a similar phenotype of hypotonia, developmental delay, and also the seizures. So besides that, the clinical features observed in these patients were consistent with the first reported patients, was there also another interesting conclusions. The author stated that additional studies and more patients with Pura mutations were needed to better understand the correlation between the genotype, which means the type and the position of the mutation, and the phenotype, so what we see as clinical symptoms, to find if there is any relation between this type of mutation and what we see in the severity of the clinical symptoms. It took quite some time to do this, but last year this paper appeared online, in which I worked together with many others, clinicians and researchers, to collect clinical details information on 32 individuals diagnosed with Pura syndrome. And with this cohort of patients, we were able to further delineate the features associated with Pura syndrome, so also the more rare symptoms, and to do a genotype-phenotype study to find out if there was any correlation between the type of the mutations and the variety in the clinical severity between the different patients. Here are some features summarized that we found as new features. So these features were not described in any of the other published papers. And the first feature, hypersomnolence, which is an excessive sleepiness, was not reported before. And when I was here at the conference 2 years ago, I talked with a lot of parents, and several of them told me about, my baby is so sleepy, could it be part of the syndrome, or is it something else? So for that reason, we decided to structurally collect information on this feature as well. So we asked all clinicians to ask the parents if this was present, and indeed it turned out that it was one of the features related to Pura syndrome. The same occurred for the excessive hiccups in uterus. So during the pregnancy, several of the mothers reported the hiccups. And I know there are also some patients known after birth that still have the frequent hiccups. There was also a remarkable soft skin present in several of the patients, and also a short stature. Not in all of the patients, just in 1 out of the 5, but there is also a trend for all the other Pura patients to be a bit shorter than the normal variation. And the last new feature was the stereotypic hand movements, which were reported by several of the clinicians. And some of the stereotypic hand movements which were reported were very similar to the hand movements which are present in patients diagnosed with another syndrome, the Rett syndrome. And for that reason, some of the other patients were also tested for Rett syndrome and were thought to have Rett syndrome. But were never diagnosed because no mutation could be found. And they were finally tested with an exome, and then it turned out that they had Pura syndrome. We found also some relatively new features, which means that it was mentioned briefly in one of the other articles, but was not mentioned as one of the core features in the Pura syndrome clinical spectrum. First one was the post-term birth, that very often a labor induction was needed for many women. There's also in several patients was a reflux disease, and this could be very severe, sometimes requiring a surgery. Hypothermia is also not a feature that is very commonly asked by a doctor to the parents of the patient. But it is also a feature that came across my mind here 2 years ago, and we decided also to ask this feature. Are there any problems with the regulation of the temperature? And yes, indeed, it is part of the syndrome. And I already mentioned several times the hypotonia in the patients. It was for sure mentioned in all the other papers that it was part of the syndrome, but they only spoke about the hypotonia during the first year of life. And it was clear that it is also present after the first year. So many patients are suffering from the hypotonia, and several complications can occur, such as problems with the hips or scoliosis due to the hypotonia. Another feature was constipation, also commonly missed by the doctors, not always asked for. But this turned out to be a major problem, and a lot of Pura patients are needing a medication for this. And the last feature was the endocrine abnormalities in almost half of the patients. Most of the patients with endocrine abnormalities had a low vitamin D, requiring suppletion for this, but also some other hormone problems were mentioned in some patients, like problems with the sex hormones, for example. What is so important about this information and to collect information on more patients is that it is essential to have more detailed information to improve Pura syndrome recognizability. The core phenotype I mentioned, like the seizures, the developmental delay, and hypotonia, is something that occurs a lot in several other syndromes as well. But those specific features, like the temperature regulation problems or the excessive sleepiness, those features are important for clinicians to better recognize the syndrome already in an early stage. And it's also important to know which features are part of the Pura syndrome for management recommendations after diagnosis. These phases are probably known by you. Maybe some of your children are part of the study we published, and their faces are on this figure. When we look at these phases, we don't think it's a very recognizable syndrome based on the face. It's not that we walk at the street and that we can say this is a Pura patient, this is not a Pura patient. But when we compare some faces, we see some similarities. For example, the eyes of some of the patients, they have very long eyelashes, fully cheeks, a relatively broad forehead, but of course, not all of them have these very subtle, what we call dysmorphisms. All those features I mentioned are very subjective. It's based on what we as clinicians think to see in the face. And we thought, can we also make this objective? For this reason, we asked a group in the UK that's led by Christopher Nelliker, with the question, can you make this more objective? So, to do this, he took all the Pura faces together and also selected a cohort of control faces, and those controls were all age and gender matched. to compare them, to compare the overlay of the faces. And the overlay of faces was created by measuring at several points in the face, which you can see here on the image. And this was the result. Here on the left side, control face, and on the right side, the Pura face. And what was interesting, last year I presented this image for the first time in Philadelphia on the meeting, on the Pura meeting, and this was not published yet. And one of the parents there asked me already early at the conference, yeah, I'm so curious to know about the Pura face, because that should be a very cute face, isn't it? So, of course, this is very funny, but if we look at this face, yeah, it's indeed a cute face if we compare it to the control. We also asked a panel of experts in this morphology to look at this face and to compare it with the control, and we asked them what they saw. And they indeed could confirm what we already saw in some of the individuals, the longer eyelashes, a bit of the fully cheeks. They also mentioned a bit more prominent philtrum, and the philtrum is the part of the skin between the nose and the upper lip, and also slightly broader, higher forehead. The third part of the study we performed was a genotype-phenotype study, which was very needed at that point. We tried to find out if we could find a correlation between the clinical severity and mutation type and the position. We did this in collaboration with Dirk Niesing and Robert Janowski. Dirk is also present at the conference. He will talk later about this. And how we did this was to classify mutations based on the predicted effect on the protein. So we have a gene with a certain mutation, and every mutation has a specific effect on the protein function. And we grouped all those mutations in 5 different classes. So we had 5 different classes and 5 different groups of patients with sort of similar type of mutations. We compared these groups of patients, all the clinical features. For example, we collected how many patients in group 1 had epilepsy and how many patients in group 2, and so on. And it turned out that we found no strong correlation between the type or the position of mutation and clinical severity. And this was confirmed also by comparing patients with exactly the same variant. There were so many clinical differences between those patients as well. So there were patients with exactly the same variant, and patient 1 had epilepsy and patient 2 didn't have epilepsy. So this also confirms that it is probably not strongly related to the mutation, and should be sought in some other mechanisms probably. Because we had now more patients and more detailed clinical information, we were also able to write the first management recommendations in the Gene Reviews article. The Gene Reviews articles covers the diagnosis, management and genetic counseling for patients and their families. And it's also a very useful document for doctors worldwide. It's really accessible, and here are a few examples of things that are included in the Gene Reviews. For example, the recommendation to do the follow-up after diagnosis in a multidisciplinary team, containing several specialists. Of course, this is not possible everywhere in the world, but it is just a recommendation, and to attend doctors that multiple doctors are needed to do the best follow-up for a Pura patient. Another recommendation was based on the diagnosis of epilepsy. This can be very hard in Pura patients because several of the Pura patients can have movement problems that very look like an epileptic seizure, but it isn't. And to help to distinguish between the real epilepsy and the non-epileptic events, so the movement disorders, it can be helpful to do a 24 hours video EEG monitoring. And another management advice was that a lot of the children have severe respiratory problems from birth, and at a certain moment these problems in most of the children stop and they recover from it, but we know that if there is an acute illness in these children, the problems can reoccur, and doctors should be aware that this can happen and that the children can need oxygen again during acute illness. In 2017 also the first case reports were reported. So case reports are articles describing one single patient with a Pura mutation. The first article was reporting on a patient, a girl with a premature puberty and all the endocrine problems that were related to this. The second case report was an interesting case report because it was about the first patient diagnosed in Japan. So 2018, of course, we still have 6 months to go, but at this moment already several publications are online, with the first one, which is the first follow-up study under the neurodevelopmental phenotype related to Pura syndrome. A second study reporting on a new rare feature. So this feature, it's called hypoglycemia. It's a very rare endocrine problem that we don't have seen in any of the Pura patients so far. But this group reported a patient which has the syndrome of this symptom as a very rare symptom of the Pura syndrome. Also a third paper occurred online, and this was the first case report of a patient with a second genetic variant. So this is about a boy which was diagnosed already with a microduplication somewhere else, but the doctors decided that this microduplication could not explain all the problems the child had. So they thought maybe there should be something else as well. So therefore they decided to do exome sequencing in these patients, and indeed they found a second variant, the Pura mutation. So then we continue to 2019. It's the question if it is 2019 or 2020 or even later. But what shall we work on in the future, and what will be for the first time published in the future? Hopefully we can work on a clinical study more focusing on epilepsy, because it's really needed at the moment to have more detailed information specific on the epilepsy. Not only about the type of the epilepsy, but also maybe some recommendations, hopefully, how to treat it in some of the patients. Maybe we will publish the first study on patients with Pura duplications. So we already have patients published with the microdeletions, the point mutations, but we know there are also some patients that have an extra copy of Pura, which is of course interesting, and we want to further investigate what the phenotype is in these patients. We will also need at a certain point the first gene reviews update, because we always have to update the management recommendations, because more patients are known now, more information is known about the phenotype and which symptoms are related to the Pura syndrome. So we need regularly updates in the gene reviews. So, and finally, hopefully we will get very soon the first results from the Pura registry, because the Pura registry will provide us with a lot of detailed clinical information. With this, I'd like to end my presentation. Many thanks to all the patients, parents, and also the referring clinicians who collaborated. Of course, the Pura Foundation does a lot of very good work, and they made it able for me to present here today. All the work done for the study I presented today to you, and also my supervisors who did a supervision of my PhD project last 4 years on neurodevelopmental disorders and next generation, including Pura syndrome.